Hello guys, as you know that today is the 10th day of India lockdown due to COVID, and today I'm gonna show you what all things have been done or what all things are going down at the primary health center. Outside our health center there was a public hand pump which we converted as a hand wash area where people passing by and patients entering a hospital were advised to wash their hands. At the entrance there was IEC material for public awareness. By maintaining the social distancing, we ran a flu clinic for screening of COVID 19 patients. During this time, we also distributed monthly medications for patients who are on treatment for non communicable diseases like diabetes, hypertension, COPD, stroke, coronary artery disease, etc., and also for TB patients, so their medications are not stopped due to COVID 19. We also provided 24 hours emergency services, delivery services, and immunization services. In between, there was spraying of sodium hypochlorite solution in the campus by the state. Here is a war room where my colleagues and my seniors planned and executed all the activities. We discussed problems. We received call from district and police regarding the suspected cases in the community. With the help of health workers, we made a team. We visited their houses. We quarantined them and would be following them up for next 28 days. We received training for COVID 19 at the district and at our CHC regarding containment plan, regarding COVID 19 survey, after which we trained our ASHAs and health workers regarding this pandemic. As directed, we made a micro plan for influenza like illness survey. In this survey, with the help of 48 ASHAs, 49 Anganwadi workers, 15 A&M or multipurpose workers, and 26 people from government, tax department, engineering department, and school and colleges, we conducted this survey in 2 days, which covered 11,700 houses in our area. Up next, there's a plan to conduct house-to-house survey by ourselves in next 3 months. We all should be thankful and should praise grassroots workers, health staff, police department, panchayat, municipality, sweepers, each and every one who have worked during this public health emergency with limited resource to fight against this corona. After our quick ILI survey, which was based on polio microplan, we found that people were underreporting their symptoms of fever and cough as they were scared. But whatever cases we found, we sent them for testing, we examined them, we gave them symptomatic management also, and we also followed up. We also home quarantined them. We also stopped labeling their houses for COVID-19 quarantine. As what we found that people were having a lot of stigma regarding COVID-19. We found that neighbors were clicking pictures of those quarantine labeled houses and they were posting in social media. Currently, our ASHA workers are carrying on their house to house COVID 19 survey. We distributed sanitizer and masks to ASHA workers. We also visited the houses of any suspected cases reported by ASHA, Sarpanch, or police department. Most of the cases, what we found was false cases which was reported by the neighbors against the people whom they want to take their grudges out. For prophylaxis, HCQ tablets were distributed to our staff. In the OPD, we are running two types of clinic. One for fever and cough as flu clinic. Reporting and follow-up of these patients are done daily. For other as NCD clinic where patients suffering from diabetes, hypertension, asthma, stroke, cardiovascular disease can get their medication. For fever screening we were provided infrared thermometer, but unfortunately it was of touching type, so we could not use it. We are disinfecting our hospital with sodium hypochlorite solution daily. We also provided health talk and IC material to our patients. We are also making sure that during this pandemic, our immunization services are not disturbed at PHC or at Sub-centre. We visited district hospital for training and for meetings. We were provided with a list of patients to track them and screen them for COVID. This list contained all the patients who are taking medications for fever and cough without any prescription from private chemist store or pharmacist. Medical mobile units are also deployed to screen for the COVID patient in the community. After so many days of lockdown, slowly it is getting relaxed. In rural, farmers are getting busy with harvesting their crops In urban, what we found, markets are getting open, and we also visited our departmental store for buying groceries. By the time our government comes up with lockdown exit strategy, we all need to stay strong and fight this pandemic together. Lockdown got extended but with some relaxations. At our PSC, we started making medical certificate for migrant workers and also for people who want to go back to their work. We received around 18 teachers to conduct a COVID survey in urban areas, which were not covered by any ASHA worker or any Anganwadi worker. We conducted 2 days rapid survey in those urban areas, and in one of the society building we found resistance from few building staff, which was later on sorted out by the help of police. Thanks to them. Towards the end of this lockdown, we found one positive case in one of the neighboring village, for which his contacts were traced and sampling was done. Now, making a containment zone, our team have started conducting an active surveillance in that area, and let's see what happens next. As the number of cases increased in our PSC area, we started temperature screening for all the patients. Patient with high temperature or flu-like symptom was sent to flu clinic, which was separated from the general clinic. At both the clinics, we took extra precautions. We made a donning and doffing room for PPE. Even in emergencies, for few patients, we had to wear complete PPE. We received rapid antigen testing kit from the district, and we started testing patient at our PSC, and we found few patient positive. After checking their eligibility, positive patients who are having mild symptoms or without symptoms were kept at home isolation, and HCQ were given for their caregivers. Patients who were severely sick, need hospitalization, or who do not have any home isolation facility were shifted to district hospital or ESI. We did contact tracing and follow up of all the patients and their contacts. We faced a lot of problem in contact tracing due to the stigma. We are reporting all the data regarding COVID to MOHFW, state and district health department, ICMR, IDSP. Patients who are home isolated were given a kit delivered through a health worker, which contained biomedical waste polybag, gloves, bleaching powder, multivitamin tablets, vitamin C tablet, and mask. Health education and IEC material was also provided. Sarpants were made responsible, and neighbors were also requested to provide food or any basic need item required for isolated house. At the end of home isolation or in between, the biomedical waste generated at the isolated house was transported to PSC through arrangement made by the sarpanch or the patient, and they were later handed over to the biomedical waste company. Immunity booster tablets and Kada are being distributed at the containment zone by the Ministry of Ayush. In between, we also noticed locust swarm attacking the Haryana farms in nearby villages. In between, I was also exposed to COVID-19 patient while attending a meeting, for which I had to visit AIMS for RT-PCR testing, and fortunately my report came negative. On the way, I saw that bus services were resumed and the physical distancing was maintained. Let's hope for the best and see what happens next. RT-PCR testing at PSC has started. There is free ambulance service to pick up and drop the patient. Routine OPD and IPD services have started. All the national programs are back into the track. It is good to see that our scientists have come up with various vaccine, and all over the world vaccination has begun. India came up with two vaccines, and I can see we are winning this fight against this corona, and by the end of this year we will resume back to the normal lives. This will be written with golden letters in the history, that how we won this battle against coronavirus.